Welcome to another edition of Where the 99 Lead. I'm Andrew Joyce, your host, and Where the 99 Leads, it's a program brought to you by the University of Pikeville, where we talk all things regarding the University of Pikeville, athletics, academics, and the Kentucky College of Osteopathic Medicine, all parts of the university. And joined now by a special guest, Dr. Peter Zajac, Associate Professor of Family Medicine and clinician and director of clinical skills training and evaluation at Kentucky College of Osteopathic Medicine. Dr. Zajac, welcome in.
How you doing, Andrew?
For those folks that are just tuned in, let's introduce Dr. Peter Zajac. Where do you come from? How did you arrive here?
I'm originally from Philadelphia, Pennsylvania, where I did all my training. I was born and raised there as well. And after completing my education at the Philadelphia College of Osteopathic Medicine, I made my way in this direction, having also served as the Osteopathic Family Practice Residency Program Director at one of our hospitals in northwestern PA. Had then gone, again, towards this direction and spent a little time in Tennessee as part of an inaugural faculty at one of our colleges of osteopathic medicine there, and was offered the opportunity to serve as Director of Clinical Skills Training and Evaluation at the Kentucky College of Osteopathic Medicine, where Susan Wetzel and myself spearheaded a new curriculum and program, which also included our standardized patients and human models.
Sure.
Currently, what we have up on the fourth floor of the new Cole building is a wonderful floor in terms of it not only has 10 standardized patient rooms, but also 2 simulation rooms, and these are topics I think we're going to be covering today.
Sure.
But it gives us the opportunity to provide the kind of training and evaluation, competency-based evaluation of our students, which is so essential in medical school training today, prior to having them go out to 3rd and 4th year clinical rotations, and then when they go to pursue a residency into their years as attending physicians.
Sure. How long have you been at Pikeville now?
I'm pleased to say and Prestonsburg is my home. I hope that no one holds that against me.
Okay.
We're in Pike County right now.
We're all Eastern Kentucky.
But I hear Pike County, Floyd County, I hear all these counties, they're all wonderful, and I'm pleased to say I've been here for 5 years and looking for many years down the road.
The Cole building.
Wonderful building.
What has it meant for students and faculty as opposed to the facilities before?
We operate and provide a lot of our lectures and lab series through Armington prior to this. And although that played an excellent role in terms of giving students the type of education they needed,
Sure.
We're able to do that same job easier now. We have 2 big lecture halls that conveniently has screens for students to be able to view our lectures in a manner that works easier for them. And now we have not only the clinical skills training evaluation floor, which is the 4th floor of our building, but we also have an OPP lab, a new anatomy lab with more room, not just to help facilitate education, but also, as you may be aware, we had an increased class size, and with roughly about 135 students now, we do need the physical space in order to make that happen.
Sure.
And I'm proud to say that we're able to do that each and every day. Our students get a wonderful education in their first 2 years, and then when they go on clinical rotations, it gives them an opportunity to get their feet wet and apply those things that they learn in their first 2 years. And I'm just happy to say, once again, the Cole building helps all that to occur. Not to mention the fact that we do have a lunchroom where I just need to go up 1 floor and I'm there. That's a big plus too. But the whole building is conducive to education and giving our students opportunities that our older building just wasn't constructed for those type of reasons.
Sure. Of course, we'll talk later about standardized patients, human models,
Sure.
state-of-the-art technology.
Absolutely.
Also involved in the Kentucky College of Osteopathic Medicine. Ladies and gentlemen, Dr. Peter Zajac, Associate Professor of Family Medicine and clinician, and Director of Clinical Skills Training at the Kentucky College of Osteopathic Medicine, and a lovely young lady, a second-year student at the Kentucky College of Osteopathic Medicine, an aspiring physician, Jamie Humes. Welcome to Where the 99 Lead.
Thank you.
Let's talk about Jamie Humes and where you come from and how you arrived in Pikeville.
I was born and raised in Detroit, Michigan, and I really wanted to go to a small school with an environment where you could be one-on-one with the teachers and get the full learning experience. So that's why I chose to come to Pikeville. I'm a second-year student, and also I wanted a school that was pretty military friendly and had programs and clubs for military students. I'm a second lieutenant in the U.S. Army Reserve and also the president of the Association of Student Osteopathic Physicians and Surgeons at the school.
And Jamie, your undergraduate studies were where?
I did my undergraduate studies at Oakland University. It's just outside of Detroit in Oakland County, and it's the home of the Bears, and I loved it there.
And it's an old rival of Pikeville College. I'm not sure you knew that, but back in the days of a legendary coach at Pikeville, Wayne Martin, some of his NAI tournament teams, they rivaled Oakland back in the day when Oakland was a much smaller school. So that's my knowledge of Oakland. I've been there because of that rivalry. Jamie Hume, second year student at the Kentucky College of Osteopathic Medicine. And Dr. Zajac, the Summer Research Fellowship Program. Let's talk about that and how Kentucky COM students benefit from participating in that program.
The KYCOM, or KYCOM Student Summer Research Fellowship Program, is a new program that has been developed over the course of the last year. We actually had 6 of our students complete the Summer Research Fellowship Program this past summer. And there were 6 of them, and I'd like to mention who they were. They were Ramina Panjwani, Colton Brusvin, Sean Desai, Robert Klein, Ravi Raithada, and Sam Hanshu, and they did an excellent job working with their mentors. And the whole concept is that we recognize the fact that even though our focus is to graduate future well-trained and rounded osteopathic physicians, we wanted to give our students who had an interest in research that opportunity.
Sure.
So about a year ago, we developed a program. The research committee and I worked on developing a program with the support of the administration, Dr. Boozer, Dr. Betts, and others, to establish a program. Which we did, and again, this past summer they completed it, and again, it gives students the opportunity to work on a research project with either an internal mentor or an external mentor, someone on campus or off campus, on a project that they have an interest in. Once they meet certain kind of criteria that have been put into the program, they receive a stipend for their work. And one of the obligations they have, and Ms. Holman, we had discussed this earlier, and it's occurring, one example of it is occurring this Friday in one of our lecture programs, and that's Current Issues in Medicine, is they need to be able to present and display their posters.
Sure.
It gives them an opportunity to get their feet wet, to learn the research methods and things that I've learned by being part of a research fellowship program that we may touch on a little bit later. And by doing so, it gives them a better understanding, if they wish to pursue things like this in the future, of what the proper steps would be in order to start and finish a research project.
Sure.
And to have these opportunities where they can present and display their posters, it gives them an opportunity to learn how to speak on a public level, answer questions and things that may be important for those who are also interested in attending these type of programs and listening to what kind of projects are out there.
Sure.
So again, we had these 6 recipients that did a fine job. In fact, 2 of our students, Ramina Panjwani, had a poster display at OMED, which is one of our national conferences sponsored by the American Osteopathic Association. And she worked with University of North Texas Health Science Center. And then we had another gentleman who, through UK by name of Sean Desai, who was actually featured in a DO magazine. So 2 of our 6 students from our summer research fellowship program class have already been featured through other venues, and I'm sure that our other students who were part of that panel, who did a great job, will find their venues as well.
Sure.
And this is a big plus because the University of Pikeville right now on a bigger level is looking at research. We have an institutional review board that we have established. We have our research committee. And there are just so many things that are occurring at the undergraduate and graduate levels that I think will be a big plus overall in terms of the type of opportunities that it will bring to our undergraduate and graduate students. Sure. It's just a win-win situation for the University of Pikeville.
Can we get a couple of examples of the research projects? You mentioned those students that they had chosen projects that they had a certain interest in. Can we get an example of a couple of the projects?
I don't have the name of their projects. Sure. Because they're very long titles.
Right.
And I was actually going to bring them along, but a lot of what was done was related to osteopathic manipulative treatment,
Right.
and how that may correlate in the case of Ramina's with diabetic type of patients.
Sure.
The type of tissue texture changes that they may experience on clinical exam. So that's one example. We had Robert Klein, who worked with Dr. Clayton, our undergraduate professor. I believe he's in biochemistry, a very nice gentleman, and they worked on different type of molecular structures of marijuana and how that could be utilized for the purposes of pain relieving effects
Right.
in certain types of patients. And so the list goes on. A few of our students who are on this panel worked on trying to detect and identify cancer genes by working with mice. So it covers a broad spectrum
Sure.
of interests, but nevertheless, anything that they can bring forward or show an interest for that can ultimately benefit themselves, more importantly, the patients that they will ultimately be taking care of, and the profession as a whole, in terms of the kind of work we're doing, what we're trying to do, ultimately that may have an impact on people's lives. And hopefully the improvement of the quality of their lives, I think, is a big plus, and I applaud our institution for undertaking such a venture.
Sure. Great benefit, not just to the students at Kentucky College of Osteopathic Medicine, but I think to the healthcare field
As a whole,
in
yeah,
our
absolutely right.
region down the road. Certainly a tremendous benefit there. Dr. Peter Zajac, our guest, an associate professor at the Kentucky College of Osteopathic Medicine, also second-year student. Jamie Humes, an aspiring physician with Kentucky College of Osteopathic Medicine, our guest today on Where the 99 Lead. Dr. Zajac, you have a research fellowship program you're personally involved in, and a paper that you will have published in the Journal of Osteopathic Medicine. Tell us a little about that.
As I mentioned earlier, and a lot of my interests stem from being involved in this program. 2 years ago, approximately 2 years ago, I was given the opportunity to be part of the inaugural class for the summer. It's a research fellowship program through the University of North Texas Health Science Center out in Fort Worth. And by being part of this program, it was wonderful. Dr. Lisa Ardone, who's in charge of the program, he and Ms. Kathleen Kearns are two wonderful people who gave us the opportunity to learn a lot of what we at one time were taught in med school but quickly forgot.
Right.
And that's research methods, the biostatistics that goes along behind it. But more importantly, it served as an impetus for getting my interest back in research.
Sure.
and to help develop some of the programs, the Student Summer Research Fellowship Program being one of them. It gave me that push and desire to be able to do more. I think the biggest plus, aside from having a paper, it's a collaborative paper that I, as a co-investigator, and others from other different colleges of osteopathic medicine have put together. Aside from having this being accepted to be published in the Journal of the American Osteopathic Association down the road, and it's entitled Somatic Dysfunction and Use of Osteopathic Manual Treatment Techniques During Ambulatory Medical Care Visits. It not only gives me an opportunity to show the product of being involved in this program, but once again, as I mentioned earlier, it gives me the opportunity to learn things to then help mentor our students and to be able to establish these types of programs where students can ultimately benefit from my experiences and be able to implement them into not only the program that we have for the students over the summer, but through other ways as well. Anymore, Andrew, you get to a certain career, and this is a wonderful feeling. And I told Ms. Holman this, and she knows me very well to know that I'm very sincere when I say this. And I'm only hoping that the students can appreciate this. But anymore, you measure success, your success, at least for me, by measuring the success of our students.
Sure.
You come into my office, you don't see diplomas, and don't take this the wrong way. If you want to hang, I have my diplomas. They're at my sister's bedroom underneath the bed in Philadelphia, and that's where they've been in boxes. I have the credentials, so don't worry about that. But what I have on my walls are examples of things that I've been involved with students, and to see them accomplish things and be successful
Sure.
makes me feel successful. And when you get to that point in your career when when you can see beyond why it is that you went into what you have chosen to do for the rest of your life.
Sure.
At the end of the day, taking care of patients and seeing good outcomes and providing the opportunity for students to experience those things that you were given the opportunity to experience at one time or are currently experiencing is what makes you feel that you have been successful. And so that may help explain why I expect a lot from them.
Sure.
And why I want them to do so well for themselves, because if they do well, I've done well. But it's a wonderful feeling to be at that point in your career where it really is about them and the patients that not only you're taking care of, but they'll be taken care of as well.
Absolutely. I can see the sincerity in you. I have to ask the question, you could be a practicing physician. What led you to become a professor in a medical school?
I think had I not gone into medicine, I probably would have gone into education. It was a weird thing when I was at Central High School in Philadelphia, which was an all-boys school. It awarded the Bachelor of Arts degree. There was a time when you had graduated from Central, you never needed to go to undergraduate school. You could go just to law school, med school.
Sure.
Anymore, they don't do that. I got an honorary degree. But back then, Drexel University came over to me, and I graduated from LaSalle, which was right next door. They came over and offered me the opportunity for a full paid scholarship to go into math or science and to teach at the Philadelphia public school level. They would have my job in place and everything.
Right.
And, and that was a wonderful opportunity that I embraced, but I still wanted to be a physician. No one's ever pushed me into becoming a physician. It was entirely my own choice. And I turned down that opportunity to go to LaSalle. I was a chemistry Russian major and graduated and just pursued the medical career. But that was the opportunity. Had I not gone to medical school and been given the opportunity and privilege to do so, education would have been my other option. And I just enjoy that much. It's something that I do day in, day out, and I look forward to.
Jamie Hume, second-year student with us today, and you have an opportunity to see these aspiring physicians from day one until they are a doctor. Talk about the process of these students as they become our physicians, taking care of us in our elderly age. Let's talk about the process. How much change takes place, number one, in a first-day student to a second-year student like Jamie?
The first time you meet our students, you meet them during the interview.
Sure.
And it's a nice feeling to see students wanting to pursue a career that you hold close to your heart and always want to strive to do the best job that you can for each and every patient you come into contact with, or in the case of if you go into education teaching. But unlike me, or very similar to me, I should say, when I started off med school, I never really comprehended how important and how much of a privilege it really would be to one day graduate and start providing care for patients. And you see that in the students in each and every class. And then you also see the maturity that occurs within the first 2 years.
Right.
When they go from first year to second year, that becomes more and more of what you wish you saw when they first started class. But, you meet them in an interview. They try so hard not only to impress you, but to be sincere and to share with you the reasons why they want to go, because this is a long path.
Sure.
And there are no guarantees along the way. And there are a lot of obstacles in terms of studying, things that can occur on a personal basis, which is why it's so important to have a balance between personal and professional life.
Right.
So they come in, a lot of it's new. A lot of them think they know more than maybe they really do.
Sure.
And when they complete their first couple block exams, I think that becomes reality.
Right.
One of the things I always tell them from my own experience is to always stay humble. Because there's always going to be someone out there who knows more than you.
Sure.
And to be able to accept that earlier on is fine. But to always be proactive, not be in the back, but come up front and work closely with the attending physicians. Show that you're interested not only in what you say, but by virtue of what you do day in and day out. And people will receive that in a way that's different than if you just want to hang around in the background.
Sure.
But I also tell them just do the best that you can and try not to leave things to the very end. And those who embrace those type of study habits and approaches and know when it's appropriate and necessary for them to come ask questions from their faculty, I think in the long run do well. A lot of it also is not just what we teach them in lecture and lab, but what they go home and do on their own time.
Sure.
Education doesn't stop in a classroom.
Right.
It goes, you have to take it home, you have to study it, practice it. And since a lot of what we do is competency-based, unless you do practice, it's not going to show during examination time.
Sure.
So as long as they do that practice and come in, you see them mature from between first and second year. By the time second year hits, you see that maturity, and they just now can't wait until they start third year when they can start going on clinical rotation. So that's always exciting for them. But I think what they learn and what's so important is there's so much information that they have to learn in such a short period of time,
Right.
that staying humble, working together, helping each other, and not being competitive. And I'm so proud of our students. The majority of them do that exactly. They're not there to compete with each other, but to compete with themselves to be the best that they can be. And I think that's one of the best features of our institution in terms of our students, is that they really strive just to be the best they can be and to help each other along the way. And that's what they're going to need to do by the time they finish third and fourth year and move on into residency. But it's that maturing process, that transition from undergraduate training to realizing that they're going to be physicians, professionals with a big responsibility.
Right.
That occurs, that you smile and you don't say anything, you just smile and you're so happy to see that. And then nothing in a world is better than when graduation occurs and they walk across that stage. You know, this past graduation, a couple students even asked me to hood them. It's just a great feeling. It's a great feeling to see them move on.
I think in second year too, you start to learn information that you can definitely see is going to be very applicable to your everyday life. So it starts to hit you. It's very important that I need to know this, and someday that this is what I'm learning, and this could save somebody's life. And it becomes a little bit more internalized. So it becomes more serious, and you just really want to make sure that you take in all the information that you can.
It's not just studying to pass an exam or an answer that I'll need down the road, but it's an answer that someone will need in life.
Right.
That's right.
Starts to hit home. Dr. Peter Zajac, Associate Professor at the Kentucky College of Osteopathic Medicine, our guest, along with second-year student Jamie Humes. And Dr. Zajac, you and 3 recent Kentucky Com graduates were published in the Osteopathic Family Physician. Tell us about the importance of scholarly work.
Again, this was my attempt. I serve as the chair of the editorial committee for the Osteopathic Family Physician, which is a peer-reviewed journal for the American College of Osteopathic Family Physicians. And as not only as chair of the committee, but I also do review and authors. I publish a patient education handout in every issue.
Sure.
This was an opportunity for me, once again, as I mentioned earlier, to give our students an opportunity for mentoring. I had several students who are now graduates, and they're doctors Manny Vogt, Abigail Holbrook, and Maria Super, and they came over and wondered whether or not they can help contribute to the writing of this paper. And I said, sure. I gave them different assignments, and before you know it, a week or two later, they came back and wanted to know whether or not what they could contribute would be worthwhile for eventually having this put into the paper and have it published. And we worked together on it. And although a lot of the final touches, because of their schedules, had to be completed by me, a lot of what they have contributed was essential and incorporated. And it was, for me, just a wonderful experience in a sense that the students were interested. These are going to be not only our future physicians, but our future authors. Sure. For not only journal publication, but for patient education. And again, to give them that opportunity was very satisfying for me. I embraced that, and we put together a paper. And it took over a year to kind of iron out and make sure all the T's were crossed and I's were dotted. But we brought it forth, they reviewed it, and it was accepted, and it was published, if I recall correctly, in the March-April issue of the 2013 Journal for this. So it was just months ago, and it was a great feeling.
Many people in our community are familiar with and have visited the med school's community clinic. Let's talk about that. First of all, what is it?
Our community clinic is a wonderful idea, and we actually have it in place on Mondays and Fridays. It's overseen by doctors Laura Griffin and Randy Littman on different days. But what it is, primarily, it's a great benefit to our community and institution in that anyone who may have any musculoskeletal complaints, whether it's a shoulder, elbow, wrist, back, lower back problem, whatever it may be, they can come in, be evaluated by either a fellow or a student under the supervision of one of those 2 physicians who are on the floor at the time. and they can receive the appropriate manipulative treatment, which doesn't require medication or anything invasive.
Right.
It's all hands-on treatment. And once they receive the treatment, our expectation is they'll feel better, and if necessary, they'll be able to come in for another visit so we can continue treatment until their concerns or problems are resolved.
So if someone's interested in coming to the community clinic, how do they go about that?
They can contact Miss Peaches Farrington. She's the one who's responsible for scheduling appointments and coordinating a lot of the activities that occur on those floors, particularly on Monday and Friday. If they contact her, and her information is on our website, then they can schedule an appointment and see one of our student doctors and physicians who oversee what goes on that floor on those 2 days.
Dr. Peter Zajac, Associate Professor at the Kentucky College of Osteopathic Medicine, and Jamie Hume, second-year med student at ChiCom, our guest on this edition of Where the 99 Lead. Kentucky College of Osteopathic Medicine has a standardized patient human model program. Let's talk about what it is and how the community might become involved.
The Standardized Patient Human Model Program, and we discussed this on one of our other shows, but it helps bring individuals who are interested in medical education, and they're individuals right from our community who want to be involved in the training and evaluation process of our students. Standardized patients and human models, let's start with standardized patients, are individuals who are trained to portray patients with certain signs and symptoms. They receive training, and what we have are OSCEs, or objective structure clinical examinations, that our students have to take, and they're prepared for that in advance. But on the day of the exam, the standardized patient is someone that the student comes into a clinical encounter with,
Right.
Given a certain scenario. If the student asks certain questions, the standardized patient provides those responses.
Sure.
And then students need to be able to not only get a good history and physical exam, but also formulate a list of possibilities of why the patient's there, and come up with an assessment, treatment, and management plan. And that's how standardized patients come into play to help aid in our students' education. Human models, on the other hand, are individuals who help facilitate male and female exams. We have individuals from our community who provide the service of rectal exams, prostate exams, breast and pelvic exams in the case of our female patients. And this is so essential because if our students don't get this type of exposure and training earlier on in their medical school training, then when they do go out in clinical rotations, they're going to be at a loss in terms of what they need to do when a patient with a certain complaint comes in, whether it's male, woman, or men-related type of health issue complaints.
Sure.
So having this experience gives them that appreciation for how to approach that individual, do the appropriate exam, and that's how both type of individuals, whether you're a standardized patient or human model, can help train our students. And then, of course, we have our individual skill assessments that help determine whether or not our students have received that competency level. But we have a great panel of both right now. If anyone is interested, they can contact Susan Wetzel, who's our Human Model Standardized Patient Program Coordinator. Her phone number is 218-5445, and if she's not there when you call, just feel free to leave a voicemail.
Sure.
But her email addresses and mine are both on the website. And if you want to, if you're interested, there's also an application that you can fill out, complete,
Right.
and turn in, and it's also available on our website.
I think something that we lose sight of is we see these students after they've graduated.
Right.
Dr. Humes, for instance, and I don't think we realize that when we have an exam, they have to have that first exam somewhere, and that's where these take place.
And even as a student, I can't stress how important that was for me going on rotation now, knowing that I can think back to this. I've done this before. I've had it in a controlled
Sure.
environment where somebody could hold my hand through it and make sure I'm doing the exam properly.
The first time experience for you, what was that like?
It's nerve-wracking. You want to make sure that your patient's comfortable. You want to make sure that you do the steps that you need to do to get a proper exam, to do things thoroughly. You don't want your nerves to take over and have their exam lack because of it. So getting that first one out of the way and having it be in a controlled environment where you can learn from it is just so important.
Kentucky College of Osteopathic Medicine students have been on the program in the past talking about mission trips and community activities they were involved in. Recently, students have been working with our veterans. Jamie Humes, I know this is a topic that's near and dear to your heart. Tell us about that project.
When you decide to be a doctor in the military, you're doing a little bit more, service to the soldiers. So that's one of the reasons that I joined. So that's why this is close to my heart. We teamed up with the Pikeville and the Prestonsburg VFW because we saw a need in the community. We saw that some of the veterans didn't understand their benefits or didn't quite get the benefits that they need for their current condition. And we saw that there's community members that have this problem too. So we came up with the idea for the Veterans and Community Screening Clinic. So now there's a place that every other month, and our goal is in the future every month, that they can go and they can determine the severity of their condition. They can determine their vital signs like their blood pressure and their glucose levels, and they can also get that osteopathic manipulative treatment without any pain medicines or invasive procedures, and they can get it all for free if they don't have the ability to get to the doctor or they don't have the ability to pay for the doctor. So we also provide a lot of education because we learn in school and we even witness the outcome that patient education, prevention, and then looking at the entire person as a whole is very important for continued wellness. So that's just something that we take to heart, and I think that it also kind of just embodies the spirit of the school. That's why the school was made, to provide services to an underserved area. So, and we see that in all of our clubs.
Sure. And our veterans, they deserve that care as much as anyone for all that they have given us. Dr. Peter Zajac, we're out of time. Associate Professor at the University of Pikeville, Kentucky College of Osteopathic Medicine. Thanks so much for being here once again. So informative. Jamie Humes, second-year med student at the Kentucky College of Osteopathic Medicine. We will need those physicians as we continue to age every day. And young lady, you keep your studies up.
Well, I will.
We'll need a doctor
And
soon.
there is just one thing I want to quickly add before we're done here. Jamie is doing an excellent job with this program. There'll be other programs, so if there's anyone interested in coming to one of our medical screenings down the road, just keep an eye out for her. She does an excellent job of informing everyone, and whether it's here in Pikeville, Pike County, or Prestonsburg, Floyd County, it's all good. It's all good, and we welcome you. So
and you
look forward to
can
these things.
find those dates on our Facebook page if you search the Facebook group SAMOPS, KYCOM, KYCOM.
And be able to search that on Facebook. Jamie, Dr. Zajac, thanks for being on.
Thank you.
You've been tuned to Where the 99 Lead. It's a program brought to you by the University of Pikeville. We talk all things regarding the University of Pikeville and Kentucky College of Osteopathic Medicine. The University of Pikeville, the leading university of Central Appalachia. I'm Andrew Joyce. Thanks for tuning in.